Did you know that 1 in 44 women will be diagnosed with uterine cancer by age 85? This statistic is a stark reminder of the importance of awareness and early detection. Uterine cancer, also known as endometrial cancer, is the most common cancer of the female reproductive organs. It primarily affects postmenopausal women, but it can occur at any age. Understanding the symptoms, causes, and diagnostic methods is crucial for early intervention and effective treatment. Let's talk about what you need to know. Uterine cancer develops when the cells in the uterus begin to grow uncontrollably. The uterus, a pear-shaped organ in a woman's pelvis, is where a baby grows when a woman is pregnant. The lining of the uterus, called the endometrium, is where most uterine cancers start. These cancers are known as endometrial cancers. There are also rarer forms of uterine cancer, such as uterine sarcomas, which develop in the muscles or other tissues of the uterus. Uterine cancer happens when abnormal cells grow uncontrollably in the uterus. These cells can form a mass called a tumor. Tumors can be benign, not cancer, or malignant cancer. Malignant tumors can invade and destroy nearby tissue and spread to other parts of the body. The exact cause of uterine cancer is not known, but certain factors can increase a woman's risk of developing the disease. There are two main types: endometrial cancers, which account for 95% of cases, and the rarer uterine sarcomas. Endometrial cancer is further classified into different types based on how the cancer cells look under a microscope. The most common type is endometrioid adenocarcinoma. Other types include serous carcinoma, clear cell carcinoma, and carcinosarcoma. Uterine sarcomas are less common and include leiomyosarcoma, endometrial stromal sarcoma, and undifferentiated sarcoma. In 2023, over 3,300 women were diagnosed, with an average age of 65. This highlights the importance of regular checkups and being vigilant about any changes in your body. Early detection can significantly improve the chances of successful treatment. It's essential to be aware of the symptoms and seek medical advice if you notice anything unusual. Watch for symptoms like heavier periods, bleeding between periods, and abdominal pain. These symptoms can often be mistaken for other less serious conditions, which is why they are sometimes overlooked. However, persistent or unusual symptoms should always be checked by a healthcare professional. Other symptoms to be aware of include pain during intercourse, pelvic pain, and a feeling of fullness in the pelvic area. Less common signs include a watery discharge, unexplained weight loss, and difficulty urinating. These symptoms can indicate that the cancer has spread beyond the uterus. It's important to note that these symptoms can also be caused by other conditions, so a thorough medical evaluation is necessary to determine the cause. If you experience any of these symptoms, don't hesitate to contact your doctor. Risk factors include age, family history, and conditions like diabetes or high blood pressure. Other risk factors include obesity, hormone replacement therapy, and a history of breast or ovarian cancer. Women who have never been pregnant or who have had fewer pregnancies are also at higher risk. Additionally, certain genetic conditions, such as Lynch syndrome, can increase the risk of developing uterine cancer. Diagnosis can involve a physical exam, ultrasounds, biopsies, and other tests. Feeling anxious, it's normal. The diagnostic process can be stressful, but it's a crucial step in determining the best course of treatment. During a physical exam, your doctor will check for any abnormalities in the uterus and surrounding areas. An ultrasound uses sound waves to create images of the uterus and can help identify any unusual growths. A biopsy involves taking a small sample of tissue from the uterus to be examined under a microscope for cancer cells. Talk to your doctor, ask questions, and lean on your support network. Remember, information is power. It's important to have open and honest conversations with your healthcare team about your symptoms, concerns, and treatment options. Support from family, friends, and support groups can provide emotional and practical assistance during this challenging time. Don't be afraid to reach out for help and take advantage of the resources available to you. Stay informed, stay empowered, educate yourself about uterine cancer, and stay up to date with the latest research and treatment options. Knowledge is a powerful tool in the fight against cancer. By staying informed, you can make better decisions about your health and treatment. Remember, early detection and prompt treatment can make a significant difference in the outcome. Take charge of your health and be proactive in seeking medical advice if you have any concerns.